Well, very often people say that the problem with healthcare today is we have a market system, and obviously market system doesn't work in healthcare, and I defy you to point to me a place where there is a market system in healthcare in this country, and I'll give you the single data point that proves we have no market system in this country when it comes to healthcare, and that's that you can't get the price of anything. Whether you're going to a hospital or to a doctor, you cannot ask for the price and get an answer. Name me a market where that's true. It's just not possible. Now, the reason we don't have a true market in healthcare today is because of federal income tax policy more than anything else. It began with World War II when we had wage and price controls. Ooh, that really worked out well. Companies couldn't attract talent by offering wages, and so they had to offer benefits. And in 1954, Congress basically codified current practice, which was not to tax health benefits. And so ever since then, we've been in a tax avoidance game with our employers. Employees get to skip out on income taxes with benefits, and employers get to skip out on the payroll taxes with benefits. The result is that whereas in 1960, patients personally paid half of all healthcare costs, today they pay less than an eighth. Now, that is not a true market system. Healthcare prices today, compared to 1960, are 2.5 times higher in relative terms. Why is that? Because over the years, patients have paid less and less and less of the cost of healthcare. We are not careful consumers as a result. And there's no doubt about the fact that producers have taken advantage of that fact, and so have insurance companies, third-party payers. Now, it's obvious, of course, that government is paying more and more of the bill, but so-called insurance companies are paying more and more of the bill too, and it's not true insurance. True insurance does not pay everyday costs, and that's what we have in healthcare today. What we call insurance is actually prepaid healthcare, and it has resulted in an overuse of technology very often when it wouldn't really make a difference to the outcome of the treatment. We still use way too much technology. We have overburdened emergency rooms. We have charges that bear no relationship to the resources that are used or the skills that are involved. We've had a destruction of rural health care. My father was a rural general practitioner in Texas, and he's retired now. We've had an increase in health prices that have moved, again, in lockstep with how little we have been paying in health care ourselves. Now, some people would say the solution is more of the same. We need more insurance. We need more third-party payers. We need more government paying for health care. But I would say that no, what we really need to do, and I agree with this, a Democrat from New York, a man named David Goldhill, who published an article in the September Atlantic magazine. We should pay for everyday health costs from our own income. We should pay for minor emergencies and minor surgeries from our savings. And it's only when we run into catastrophic situations that insurance should step in. And what we really need to do, true solutions, are to put health expenditures on an equal income tax footing in some way, shape, or form. Either make them all non-taxable or make benefits taxable. Whatever you do, I guarantee you, if you put health care expenditures on an equal tax footing, I'll go to my employer, I'll say, give me the cash, and I'll go and buy my own catastrophic plan, true insurance plan. We need to expand health savings accounts, which were signed into law by President Bush under the Medicare Part D reform. Health savings accounts, you can save money, and as long as you spend that money only on health care, it's never taxed. And we should expand that. We should allow people to save as much as they want to. And we should make it transferable. Americans are very generous, and they will help other Americans. Absolutely, I believe that. And if they can will that money to their children, give it to others who are deserving, they'll do it. We need to keep Medicare promises for those who are over 60, but we're going to have to start phasing it out. It's too costly, and it is not financing itself. We need to make Medicaid recipients take on more financial responsibility. Co-pays set back in the 1950s are at $5 and $1. Most people don't even bother to charge them. And we need to deregulate insurance. Let it be sold across state lines and deregulate all of the many mandates that are on insurance, health insurance in state after state.